Hello friends, welcome all of you on my YouTube channel here Anand Nursing File. Today in this video we learn about important nursing care plan HIV/AIDS. This is very important for examination purpose or for the practical work. In this video we learn total 10 number of nursing care plans. This is very easy and simple nursing care plan. You learn this through this video very easily. तो आइए देखते हैं nursing care plans on HIV/AIDS. Here we learn nursing care plan for HIV patient acquired immunodeficiency syndrome, जिसको AIDS के नाम से जानते हैं. Acquired immunodeficiency syndrome is a immunodeficiency disorder caused by the retrovirus human immunodeficiency virus. Means AIDS एक इम्यूनोडेफिशिएंसी डिसऑर्डर है जो रेट्रोवायरस HIV मीन्स जिसको ह्यूमन इम्यूनोडेफिशिएंसी वायरस के नाम से जानते हैं, इसके कारण ये होता है. तो आइए देखते हैं फर्स्ट नर्सिंग जो हमारे केयर प्लान्स कौन कौन से होने वाले हैं. यहाँ आपका फर्स्ट नर्सिंग केयर प्लान होगा रिस्क फॉर इन्फेक्शन, सेकंड हाइपरथर्मिया, थर्ड फैटिग. नंबर फोर्थ नर्सिंग प्लान होगा इम्बैलेंस न्यूट्रिशन लेस देन बॉडी रिक्वायरमेंट. नंबर फोर फिफ्थ एंजाइटी अफेयर. नंबर सिक्स पेन. नंबर सेवन इम्पेयर्ड स्किन इंटीग्रिटी. नंबर एट डिस्टर्ब थॉट प्रोसेस. नंबर नाइन पावरलेसनेस. नंबर टेन डेफिशिएंट नॉलेज. तो ये सारे नर्सिंग केयर प्लान आप यहाँ पर लर्न करने वाले हो. तो फर्स्ट देखते हैं जो हमारा नर्सिंग केयर प्लान है रिस्क फॉर इन्फेक्शन. यहाँ पर हम नर्सिंग केयर प्लान में जो नर्सिंग प्रोसेस स्टेप है यूज़ करेंगे, जैसे कि नर्सिंग असेसमेंट, डायग्नोसिस, गोल, नर्सिंग इंटरवेंशन, रेशनल एंड एवेल्यूशन. हम नर्सिंग केयर प्लान के जब इंटरवेंशंस फिनिश होंगे उसके बाद लिखेंगे नीचे की तरफ. तो फर्स्ट देखते हैं नर्सिंग असेसमेंट. सब्जेक्टिव डाटा आर नॉट एप्लीकेबल बिकॉज दिस इज द रिस्क डायग्नोसिस एंड ऑब्जेक्टिव डाटा फॉर दिस केयर प्लान. एयर assess the vital sign and monitor sign of infection. Next, monitor the WBC count. Next, नर्सिंग डायग्नोसिस देखते हैं. यहाँ पर रिस्क फॉर इन्फेक्शन में भी रिलेटेड टू डिप्रेशन ऑफ द इम्यूनिटी. गोल होगा टू रिड्यूस रिस्क फॉर इन्फेक्शन. नर्सिंग इंटरवेंशंस एंड रेशनल. यहाँ पर देखते हैं फर्स्ट इंटरवेंशन. फर्स्ट नर्सिंग इंटरवेंशन यहाँ पर मॉनिटर वाइटल साइन एंड साइन ऑफ इन्फेक्शन. रेशनल होगा पर to establish baseline information related to infection. Here, second intervention, wash hands before and after care contact. Instruct patient and significant other to wash hands as indicated. Rational, reduce risk for risk of cross contamination. Number third intervention होगा. Here, provide a clean, well ventilated environment, screen visitors and staff for sign of infection and maintain isolation precautions as indicated. यहाँ पर रेशनल होगा रिड्यूस नंबर ऑफ पैथोजेंस प्रेजेंटेड टू द इम्यून सिस्टम एंड रिड्यूस पॉसिबिलिटी ऑफ पेशेंट कॉन्ट्रैक्टिंग ए नोजोकॉमिनल इन्फेक्शन. नंबर फोर्थ इंटरवेंशन होगा असेस रेस्पिरेटरी रेट डेप्थ. रेशनल होगा रेस्पिरेशन कंजेशन और डिस्ट्रेस में इंडिकेट डेवलपिंग न्यूमोसिस्टिक न्यूमोनिया. नंबर फिफ्थ एग्जामिन स्किन एंड oral mucous membrane for white patch or lesions. Here रेशनल होगा oral candidias, herpes, cytomegalovirus and cryptococcus are common opportunistic disease affecting the cutaneous membrane. Number sixth intervention, clean patient nails frequently, file rather than cut and avoid trimming cuticles. Here रेशनल होगा reduce risk of transmission of pathogens through break in the skin. Fungal infection along the nail plate are common. Number seven intervention, inspect wound and site of invasive device. Here noting sign of local inflammation and infection. रेशनल होगा early identification and treatment of secondary infection may prevent sepsis. Number 8 intervention, dispose of needles and sharp in rigid puncture resistant container. Rational होगा prevent accidental inclusion of the caregiver. After writing these interventions, we write here the evaluation step. Here, evaluation is reduce risk for infection. Means जो हमारा goal था to reduce infection, ये to reduce risk for infection वो यहाँ पर complete हो गया है, और इस तरह से हम यहाँ पर evaluation लिखेंगे और ये first care plan finish हो गया है. Next नंबर देखते हैं second care plan. Second care plan होगा hyperthermia. Here nursing assessment, subjective data, patient is saying that is feeling warm. Objective data here, assess vital sign, temperature 13.5 degrees Fahrenheit, rapid and shallow breathing, weak pulse and flushed skin, profuse sweating. After these assessment data, we write here the nursing diagnosis for care plan. Here care plan is hyperthermia related to the HIV/AIDS infection. Your goal to reduce temperature within normal limit. Interventions rational देखते हैं. First intervention, monitor patient's temperature at least every hour. Rational होगा to gather baseline information for the effectiveness of the interventions. Number second, provide calm and cool environment. Rational होगा to reduce body temperature. Number third intervention, encourage patient for rest. Rational होगा number third to conserve energy. Number fourth intervention, provide comfortable position and elevate the head of the bed, head end of the bed. Rational होगा for relaxing the patient and facilitate respiration. Number fifth interventions, offer a tepid sponging air to facilitate the body cooling down and to promote comfort. Number sixth intervention होगा provide plenty of food plenty of water for drinking. Rational होगा sixth to prevent dehydration. Number seven intervention, administer medications as prescribed, antibiotic to reduce temperature or fever. After these interventions, we write here the evaluation of the second nursing care plan. Here now body temperature reduced to normal range. Next take the nursing care plan number third, fatigue. In nursing assessment, subjective data, patient verbalize unremitting overwhelming lack of energy and inability to maintain usual activity. Object data, here patient showing lethargy, listlessness and behavior, listlessness behavior and disinterest in surroundings. यहाँ पर diagnosis होगा fatigue related to decreased metabolic energy production. गोल होगा to reduce fatigue. Interventions rational देखते हैं. First T is deep breathing exercise and relaxation techniques. Rational होगा provide strength and relax to patient. Number second intervention, plan care to allow for rest period. या rational होगा frequent rest period, conserve energy. Number third interventions, encourage alternate period of physical activity with rest and sleep. Rational होगा to gradually increase the patient's tolerance of activities. Number fourth intervention, assist with self care needs when indicated, keep bed in low position, pathway clear. Furnitures assist the with ambulation. या पर rational होगा weakness may make activity of daily living difficult to complete or place the patient at risk for injury during activities. Number fifth interventions, encourage patient to do whether possible self bathing, sitting up in chair, walking, increase activity level as individually is able. Rational होगा enhance strength and stamina and enable patient to become more active without undue fatigue. Number six interventions, refer to the physical and occupational therapist. Rational होगा program daily exercise and activities help the patient maintain and increase strength and muscle tone and enhance sense of well-being. After providing these interventions, we write the evaluation step. Now here evaluation is now fatigue reduce and patient perform activity of daily living well. Here number fourth care plan, imbalance nutrition less than body requirement. Here assessment, subjective data, patient verbalize about lack of interest in food. Objective data here, assess sign of malnutrition, assess weight, assess intake and output. After writing these data, we write here the nursing diagnosis. Here nursing diagnosis is imbalance nutrition less than body requirement. related to inability to ingest and digest nutrients. Goal होगा to maintain nutritional status. Nursing intervention and rational here assess patient's ability to chew, taste and swallow. Rational होगा lesions of the mouth, throat and esophagus cause dysphagia. Limit patient's ability to ingest food and reducing desire to eat. Number second intervention here created daily weight chart and food and fluid chart here. Rational होगा to effectively monitoring the patient's nutritional intake and progress in weight goals. But third intervention होगा note drug side effect. Here Judobidine can cause altered taste, nausea and vomiting. Here number fourth interventions plan diet with the patient and include significant other suggest food from home if appropriate. Provide small frequent meal and snacks of nutritionally dense food and non-acidic foods and beverages with choice of food palatable up to patient. Rational होगा including patient in planning gives sense of control of environment and may enhance intake fulfilling craving for the non-institutionalized food may also improve intake. Number next intervention increase high calorie nutrients food, some of which may be considered appetite stimulants. Here rational होगा foods with higher fat content may be recommended as tolerated to enhance the taste and oral intake. Number sixth interventions here limit food that induce nausea and or vomiting or are poorly tolerated. Avoid severing avoid serving very hot liquids and food here because of mouth sore or dysphagia. Number seven interventions schedule medications between meals if tolerated and limit fluid intake with meals unless fluid has nutritional value. Number rational होगा gastric fullness diminishes appetite and food intake. Number eight interventions encourage as much physical activity as possible. Rational होगा as may improve appetite and general feeling of well-being. Number nine intervention provide frequent mouth care observing secretion precautions. Avoid alcohol containing mouthwash. Rational होगा reduce discomfort associated with nausea and vomiting or a lesion, mucosal dryness and halitosis. A clean mouth may enhance appetite and provide comfort. Number 10 interventions here provide rest period before meals. Avoid stressful procedure close to mealtime. Rational होगा minimizes fatigue, increase energy available for work of eating and reduce chance of nausea and vomiting. Number 11 interventions encourage patient to sit up for a meal. Rational होगा facilitate swallowing and reduce risk of aspiration. Number 12 interventions maintain NPO status when appropriate. Rational होगा may be needed to reduce nausea and vomiting. Number 13 intervention interest or maintain angitube as indicated. Rational होगा may be needed to reduce vomiting or to administer tube feedings, esophageal irritation from existing infection. Candida herpes or KS may provide site for secondary infections and trauma. Therefore, tube should be used with caution. Number 14 interventions administer medications as indicated. Here medication name antimetabolic procorprezine, compazine, promethazine. Rational होगा reduce incidence of nausea vomiting, possibly enhance oral intake. And vitamin supplements and medications here rational होगा correct vitamin deficiency and here appetite stimulants donabinol here act as appetite stimulant in the presence of AIDS. Number here antidiarrheal medications here lomotil loperamide to treat diarrhea and here antibiotic therapy here may be given to treat the prevent infection involving GI tract. After writing these interventions, we write here the evaluation step. Now here evaluation is nutritional status maintained. Next care plan here the anxiety and fear here nursing assessment. Subjective data patient express concern regarding the changes in life. Objective data here patient looking anxious, hopelessness and restlessness. Here nursing diagnosis anxiety and fear related rates goal to reduce fear and anxiety. नर्सिंग इंटरवेंशन एंड रेशनल देखते हैं फर्स्ट इंटरवेंशन या assure patient's general condition रेशन होगा, provide baseline information. Number second intervention, maintain frequent contact with patient and never leave patient alone. Rational, provide assurance that patient is not alone or rejected. Number third interventions, provide accurate and consistent information regarding prognosis. Rational work can reduce anxiety. Number fourth intervention, provide open environment in which patient feels safe to discuss feeling or to refrain from talking. Rational work help patient feel accepted in present condition without feeling judged and promote sense of dignity and control. Number fifth interventions, explain processes, providing opportunity for question and honest answer, arrange for someone to stay with patient during anxiety producing procedure and consultations. Rational accurate information allow patient to deal more effectively with the reality of the situation, thereby reducing anxiety and fear of the unknown. Number six interventions, identify and encourage patient interaction with the support system, encourage verbalization and interaction with family and significant others. Rational होगा reduce feeling of isolation if family support system are not available, outside source may be needed immediately. Number seven interventions, provide a reliable and consistent information and support for significant other rational, allow for better interpersonal interactions and reduce of anxiety and fear. After writing these interventions, we write their evaluation step. Now your evaluation is fear and anxiety reduced. But six number nursing care plan, pain. Nursing assessment subjective data. Patient verbalize about pain. Objective data are grimacing, crying, mourning behavior and distraction guiding behavior. Guarding behavior. Sorry. A nursing diagnosis, pain related to disease process. Your goal to relieve pain. ये नर्सिंग इंटरवेंशंस रेशनल देखते हैं. फर्स्ट इंटरवेंशन होगा यहाँ पर डिटरमाइन पेन हिस्ट्री और लोकेशन ऑफ पेन, फ्रीक्वेंसी, ड्यूरेशन एंड इंटेंसिटी यूजिंग न्यूमेरिक रेटिंग स्केल 0 to 10 स्केल. रेशनल होगा इन्फॉर्मेशन प्रोवाइड बेसलाइन डाटा टू evaluate the effectiveness of the intervention. Number second, encourage strategies of the pain relief that pain has used successful in previous pain experience. Rational होगा encourage the success of pain relief strategies accepted by the patient and family. Number third interventions here, evaluate and be aware of the pain effect of particular therapies like surgery, radiation, chemotherapy, biotherapy. Patient AIDS with cancer, provide information to patient and significant about what to expect. Here, a wide range of demonstration are common in seasonal pain, burning, skin, low back pain, headache, depending on the procedure and agent being used. Pain is also switched with the invasive procedure and diagnose of treatment of here mis writing here AIDS or cancer. Number next, fourth, air non provide non-pharmacological comfort measure, massage, repositioning, back rub and diversional activities, music, television, air promote relaxation and help refocus attention. Number fifth interventions, air encourage use of stress management skills or complementary therapies, relaxation techniques, visualization, guided imaginary, biofeedback, laughter, music, aromatherapy and therapeutic touch. ये rational होगा enable patient to particular activities in non-drug treatment of pain and enhance sense of control. Number six interventions, provide cutaneous stimulation, heat or cold massage here. You may decrease inflammation, muscle spasms, reducing associated pain here. Number seven interventions, here evaluate pain relief and control at regular interval, adjust medications regimen as necessary. Here, rational goal is maximum pain control with minimum interference with activity of daily living. Number eight interventions, discuss use of additional alternative of complementary therapies, acupuncture and acupressure. यहाँ rational होगा may provide a reduction or relief of pain without drug or related side effect. Number next, 9 here administer analgesics and indicated opioid, codeine, morphine, here acetaminophen, non-steroidal anti-inflammatory, aspirin, ibuprofen, corticosteroid to relieve pain and inflammation. After writing these interventions, we write here the evaluation step. Now here evaluation is pain relieved and patient feel comfort. Number here next 7 intervention. Risk for impaired skin integrity here, subjective data not applicable, and here objective data assess for skin lesion, ulceration, decubitus ulcer formation. After writing these assessment, we write here the nursing diagnosis risk for impaired skin integrity related to immunological deficit. Goloka. To maintain skin integrity, nursing interventions additional here assess skin daily, note color, target, circulation, and sensation. Aeration logo establishes a comparative baseline, providing opportunity for timely intervention. Number second interventions. Maintain and instruct and code skin hygiene was thoroughly pat dry carefully and gently massage with lotion or appropriate cream. Ration logo maintain a clean dry skin, provide a barrier to infection. Number third intervention. Change patient position frequently. Ration logo reduce stress on pressure point, improve blood flow to tissue and promote healing. Number fourth intervention. Maintain clean, dry, wrinkle-free linen, prefer soft cotton fabric, rational. Skin frictions caused by the wet or wrinkled or rough sheet lead to irritation of fragile skin and increase risk for infection. Our fifth intervention, encourage ambulation as told rational yoga. Decrease pressure on the skin, prolonged bed rest. Number next intervention, cover open pressure ulcers with sterile dressing or protective barriers. Tegaderm, duoderm as indicated. Rational yoga may reduce bacterial contamination, promote healing. Number seven intervention, obtain culture of open skin lesion. Rational yoga identifies pathogens as appropriate treatment choices. Number eight interventions, apply and administer medications as indicated. Rational yoga used in treatment of the skin lesion. Number nine interventions, refer to the physical therapy for regular exercise as and activity program. Rational yoga promote improved muscle tone and skin healthy. After writing these interventions, we write here the evaluation step. Now here evaluation is skin integrity maintained. Number 8 care plan here, disturb thought process. Here nursing assessment, after asking questions we find that patient is disoriented. Here objective data, altered attention spasm, distractibility, memory deficit. Here diagnosis is disturbed thought process related to CNS infection by HIV. गोल होगा to maintain thought process. Nursing interventions rational देखते हैं. First intervention assess mental and neurological status. rational होगा to provide baseline information. Number second interventions assess for the anxiety grief. ये rational होगा we contribute to know patient's general condition. Number third interventions monitor medications regimen and uses. ये rational होगा some drugs may have adverse side effect. Haloperidol can seriously impair motor function in patient with its dementia complex. Number fourth interventions maintain a pleasant environment with appropriate auditory, visual, and cognitive stimuli. Rational yoga providing normal environmental stimuli can help in maintaining some sense of reality orientation. Number fifth interventions provide cues for reorientation. Put a radio, television, calendar, clocks, room bill, and outside view. If necessary, use patient's name, identify yourself. Rational yoga frequent reorientation to place and time may be necessary, especially during fever and or acute CNS involvement. Next intervention, discuss use of data book, list other devices to keep track of activities. Rational yoga. These techniques help the patient manage problem of forgetfulness. Next intervention said encourage family and significant other to socialize and provide reorientation with current news, family events. Here rational yoga familiar contact are often helpful in maintaining reality orientation, especially if patient is hallucinating. Number 9 interventions provide support for significant other, encourage discussion of concern and fear. Here rational yoga help in coping abilities. Next, administer medications as indicated here. Zidovudine, retrovid, and other antiretroviral drugs alone or combination to improve the neurological and mental functioning for the undetermined period of time. Next medication antipsychotics, haloperidol, aldol, and or anti-agents lorazepam. Here Rational cause and use may help with the problem with sleeplessness, emotional lability, hallucinations, suspicious, and agitations. Number next interventions refer to counseling as indicated here. Rational may help patient gain control and presence of thought disturbances or psychotic symptomatology. After writing these interventions, we write the evaluation step. Now, where evaluation is maintained thought process as usual reality orientation. Number nine care plan here, powerlessness here. Nursing assessment subjective data here. Patient is say that I feel loss of control over on life. Here objective data here. Patient show anger, apathy, withdrawal passively. Here diagnosis is powerlessness may be related to confirmed diagnosis of a potentially terminal disease. Here aids goal होगा to reduce powerlessness. Nursing interventions rational देखते हैं. First intervention identify factor diagnosis of a terminal illness, lack of support system, lack of knowledge that contribute to the patient feeling of powerlessness. Rational होगा fear of AIDS by the general population and the patient's family significant other in the most profound cause of patient's isolation. Number next interventions assess degree of feeling of helplessness. Rational होगा determine the status of the patient and allow for appropriate interventions. Number third interventions encourage patient and control and responsibility as much as possible. Identify things that patient can and cannot control. Rational होगा may enhance feeling of the control and self-worth and sense of personal responsibility. After writing these interventions, we write here the evaluation step. Now here evaluation is powerlessness, reduce acknowledge feeling and health way to deal with them. Number 10th or last care plan here deficient knowledge. In nursing assessment, here subject to data, patient want to information about AIDS, HIV/AIDS. Our objective here, inaccurate follow through of instructions, development or preventable complications. Here, nursing diagnosis, deficient knowledge related to lack of exposure, recall information, misinterpretations. Goal होगा to improve level of knowledge. In nursing interventions, rational first assess the patient's knowledge. Rational होगा to know patient's knowledge about the AIDS. Number second interventions, educate patient about the AIDS, its etiology, manifestation, transmission, prevention, and treatment. Here rational होगा to improve the patient's knowledge. Here third interventions, instruct patient and caregivers concerning infection control. Rational होगा reduce risk of transmission of the disease. Fourth interventions, stress necessity of the daily skin care, including inspecting skin fold, pressure point, and perineum, and of providing adequate cleaning and protective measure, ointment, padding. Here, rational का healthy skin provide barrier to infection, measure to prevent skin disruption, and associated complications are critical. Number fifth interventions, ascertain the patient and significant other can perform necessary oral dental care review procedures as indicated, encourage regular dental care. Rational होगा the oral mucosa can quickly exhibit severe progressive complications. Studies indicated that 75% of AIDS patients have some oral symptoms. Therefore, prevention and early interventions and are critical. Number 6 interventions, review dietary needs, high protein, high calorie, and way to improve intake when anorexia, diarrhea, weakness, depression interfere with intake. Rational होगा promote adequate nutrition necessary for healing and support of immune system, enhance feeling of well-being. Number 7 intervention, discuss medication regimen, interactions and side effect. Here rational होगा enhance cooperation with or increase probability of the success with the therapeutic regimen. Number 8 interventions, stress importance of adequate rest. Here rational होगा help manage fatigue, enhance coping abilities and energy level. Number 9 intervention, encourage activity and exercise at level that patient can tolerate. Rational होगा stimulate release of endorphins in the brain, enhance sense of well-being. Number 10 interventions, stress necessity of continue health care and follow-up. Rational होगा provide opportunity for altering regimen to meet individual and changing need. After providing these interventions, we write at the evaluation step. Now your evaluation is now patient level of knowledge improved than previous. तो फ्रेंड्स ये था आज का हमारा वीडियो नर्सिंग केयर प्लान फॉर पेशेंट विद एड्स HIV एड्स. आपको वीडियो कैसा लगा इसके लिए अपने लाइक्स कमेंट जरूर भेजिएगा एंड शेयर दिस वीडियो विद 10 नर्सिंग केयर प्लान. दिस इज स्पेशल nursing care plan video. Share with your friends and subscribe my YouTube channel Anna Nursing File Preparation for the Nursing Competition Examination. फ्रेंड्स जिन्होंने अभी तक सब्सक्राइब नहीं किया प्लीज़ सब्सक्राइब माई यूट्यूब चैनल. Here we provide different nursing related material, nursing notes, nursing recruitment material, image-based question, nursing care plan, case study, community-related care plans, family folders, case study. So friends, please subscribe my YouTube channel and press bell icon also. Thank you.